Hi, I'm Chin. Let's watch the video and learn about Birman cat. The Birman, also called the sacred cat of Burma, is a domestic cat breed. The Birman is a long-haired, color-pointed cat distinguished by a silky coat, deep blue eyes, and contrasting white gloves on each paw. The breed name is derived from Birmanie, the French form of Burma. The Birman breed was first recognized in France by the Cat Club de France in 1925. Then in England by the Governing Council of the Cat Fancy, GCCF, in 1966, and in United States by the Cat Fanciers Association, CFA, in 1967. It is also recognized by the Canadian Cat Association, CCA, and the International Cat Association, TICA, in 1979. 1. History. No clear record of the breed's origin exists. They are most often claimed to have originated as the companions of temple priests in northern Burma in the Mount of Lu. Many stories exist of how the cats first came to France, including pairs of cats being given as a reward for helping defend a temple, or being smuggled out of Burma by a Vanderbilt. Another pair of Birmans were said to have been stolen and later imported to France by Thady Haddish. The first traces of historical Birmans go back to Émile Leotardi in Nice, France. Many believe, as legend will tell, that the breed originated in Burma, now known as Myanmar, among the temples of ancient times and alongside priests. However, there are also some that later believed the felines came to Europe, namely France, from somewhere in Asia, which has been spread from other legends and stories passed around as well. Regardless of the numerous stories and folklore that go around, there is a positivity that the Birman cat breed was found in France as early as the 1920s. And many different stories continue to surface about the mystique that lies behind their history. Birmans were almost wiped out as a breed during World War II. Only 2 cats were alive in Europe at the end of the war, a pair named Orloff and Xenia de Cauba, both belonging to Baudouin Crevoiset. The foundation of the breed in post-war France were offspring of this pair. They had to be heavily outcrossed with long hair breeds such as Persian and Siamese to rebuild the Birman breed. By the early 1950s, pure Birman litters were again being produced. The restored breed was recognized in Britain in 1965 and by the CFA in 1966. 2. Appearance. Birmans have a medium-sized, rectangular body with a broad face and distinct Roman nose. Their ears are ideally as wide on the base as they are tall and should be set as much on top of the head as on the side. The eyes are rounded and should be a deep sapphire blue. The Birman's fur is medium-long and should have a silky texture. Unlike a Persian or Himalayan, they have no undercoat, thus are much less prone to matting. Coat color is always pointed, save for the contrasting pure white, symmetrical, gloves, on each paw that are the trademark of the breed. The white must involve all toes and in front must stop at the articulation or at the transition of toes to metacarpals. These gloves should extend noticeably further up the back of the leg, finishing with an inverted V extended half to 3/4 up the hock. Any other spot of white on the points is considered a serious fault. The base body color is white to cream, with a wash of color that corresponds to the points, but is much paler. Recognized point colors are seal, chocolate, blue, lilac, red, or cream. Tabby and tortie variations in seal, chocolate, blue or lilac are also allowed. Other colors are in development. Like all color point breeds, Birman kittens are born white and begin developing their points after 1 week if a dark color and 14 days or more if the points are clear, or lighter colored. Their coats do not reach full development up until the cats are 2 years old. 3. Health. The most severe threat is feline hypertrophic cardiomyopathy, HCM. The most common heart disease seen in cats. In Birman cats, it is thought to be inherited as an autosomal dominant trait. HCM is a progressive disease and can result in heart failure, paralysis of the hind legs due to clot embolization originating in the heart, and sudden death. Birman cats have a high serum concentration of creatinine and symmetric dimethylarginine. But most Birman cats have higher concentrations of creatinine than SDMA. Creatinine is a creatine phosphate and is produced during metabolism of creatine, and is excreted through urination. SDMA is a methylated form of the amino acid arginine and is released during normal catabolisms of body proteins. Levels of creatinine and SDMA are found when Birman cats are tested for chronic kidney disease, for which they are at high risk. Birman cats are also at risk of developing feline infectious peritonitis, a disease that alters the renal function in the cats. Feline audiogenic reflex seizures, FAS, a recently discovered type of epilepsy in cats, is believed to be particularly common in Birman cats.